every 40 minutes, an elderly person ends up in the hospital with a kidney complication that could have been prevented just by looking at their tongue. This isn't superstition. This is physiology, and a warning you can't ignore. It might sound surprising, but subtle changes in tongue health like a pale color, thick white coating, deep cracks, or dryness can be among the earliest clues that your kidney function is declining. Before the swelling, before the back pain, even before the fatigue shows up, your tongue might already be sounding the alarm. And this matters more than you think. According to the National Institute on Aging, nearly 1 in 3 adults over 60 already has reduced kidney function, most without even knowing it. The early stages of chronic kidney disease are often silent, which is why doctors call it a hidden epidemic among seniors. So why does the tongue reflect this? The answer lies in biology. Your kidneys are responsible for filtering toxins, managing fluids, and balancing minerals. When they begin to struggle, those imbalances can affect saliva production, oral tissue health, and even the blood flow to your tongue. The result? Visible changes in color, texture, and coating right on your tongue. In this video, we're going to walk through the top 5 tongue signs that may reveal kidney trouble after 60. I'll explain what to look for, what each sign means, and what steps to take if you notice them. And if you care about aging well and staying ahead of disease before it starts, hit the like button, subscribe to Golden Aging Health, and turn on the notification bell so you never miss our newest videos on senior health and prevention. Tongue sign number 1, pale or white-coated tongue. Let's begin with one of the most visible yet misunderstood tongue symptoms, a pale tongue or a white-coated tongue. Now, sure, a little coating could be harmless, but if your tongue looks unusually pale or stays coated even after cleaning, especially if you're over 60, it may be an early sign that your kidney function is under strain. Here's the medical reason. When the kidneys start to decline, they can't produce enough erythropoietin hormone that helps make red blood cells. This leads to anemia, which often shows up as paleness on the tongue and inside the lips. The National Kidney Foundation reports that nearly 70% of people with stage 3 or 4 chronic kidney disease develop anemia even before they notice other symptoms. A thick white coating, on the other hand, may signal uremic buildup when toxins the kidneys should eliminate begin surfacing through the saliva. According to Mayo Clinic, this can weaken oral immunity and even lead to infections like thrush in seniors with compromised kidney health. I still remember an email I received from Margaret, a 72-year-old retired teacher from Ohio. She wrote, "I always assumed my white tongue was just from dryness or getting older. But after watching your video, I decided to ask my doctor about it. Turns out, my kidney function had already dropped. My GFR was at 42. That's stage 3 chronic kidney disease. And she had no idea." Margaret's story is more common than we'd like to believe, and it's a powerful reminder that sometimes the body speaks softly before things get serious. So if you've noticed your tongue looking pale or coated more than usual, don't ignore it. It might be more than just dryness. It could be your body's early warning sign of kidney trouble after 60, and catching it now could make all the difference. And I encourage you stay with me through all 5 signs. Then take a mirror, check your tongue carefully, and ask yourself, is my body trying to tell me something? Tongue sign number 2, cracks or fissures on the tongue. At first glance, cracks on the tongue might seem harmless. Some people even refer to it as geographic tongue because of the unusual map-like patterns it forms. But what if I told you those grooves could actually be your kidneys trying to send you a serious warning? This isn't just a cosmetic issue. When your tongue appears dry, cracked, or split down the middle, especially after the age of 60, it's often linked to chronic dehydration caused by declining kidney function. Here's what's happening inside the body. Healthy kidneys are designed to concentrate urine and retain water efficiently. But as kidney function starts to drop, your body loses the ability to manage fluids properly. This leads to internal dryness, electrolyte imbalance, and a gradual drying out that often shows up first on your tongue, not your skin. A study featured in the Journal of Oral Pathology and Medicine revealed that older adults who had fissured tongues were much more likely to be in the early stages of chronic kidney disease, even in cases where classic symptoms like fatigue or swelling had not yet developed. I remember speaking with Thomas, a 68-year-old mechanic from Arizona, who said his tongue had looked like dry earth for years. He never thought much of it. But when he finally went in for testing, his doctor found elevated creatinine levels and protein in his urine, early kidney damage that had gone undetected. He told me, "No one ever said my tongue could mean something serious. I just thought I needed to drink more water." That's the real danger. Most people never suspect the connection. So if your tongue has deep lines, rough patches, or feels unusually dry, don't ignore it. And I'd love to hear from you. Have you ever noticed changes in your tongue like this? Share your experience in the comments below. Tongue sign number 3. Swollen or enlarged tongue. When Lisa, a 66-year-old retired librarian from Florida, first noticed that her tongue felt unusually large in the mornings, she didn't think much of it. She assumed it was just stress or maybe a side effect of grinding her teeth at night. Her dentist even suggested it could be jaw tension. Still, something didn't sit right. During a routine checkup, Lisa casually mentioned how her tongue often felt thick and uncomfortable when she woke up. Her doctor listened carefully and recommended a round of blood tests. The results came back with something unexpected. Lisa had entered the early stages of chronic kidney disease. Her kidneys were no longer filtering fluids effectively, and the excess fluid had started building up in her soft tissues. She couldn't see it on her face or legs yet, but the swelling was clearly visible in her tongue. It might sound surprising, but this type of symptom is far more common than most people realize. A swollen or enlarged tongue can be one of the body's first ways of signaling that the kidneys are beginning to struggle. Recent findings shared by the National Kidney Foundation highlight that fluid retention is among the earliest and most widespread symptoms of kidney decline in older adults. What's striking is that this fluid buildup often starts showing in soft tissues like the tongue long before swelling appears in more obvious places like the ankles, hands, or face. This makes the tongue one of the body's most underappreciated early warning systems. If you've experienced anything like that, don't ignore it. What seems like a minor irritation could be an early warning from your kidneys. Give this video a like to help more people discover these silent but important early signs of kidney trouble. Every click helps us spread awareness to those who might be ignoring these symptoms without even realizing it. And keep watching, because the next tongue sign may seem completely unrelated to your kidneys at first glance, but it could be one of the earliest red flags your body sends. Most doctors miss it, but you won't. Tongue sign number 4. Burning sensation or metallic taste. A burning tongue or a strange metallic taste in your mouth might not seem like something serious. Many seniors chalk it up to aging, new medications, or changes in diet. But few people realize that this odd sensation can be linked to something much deeper: toxic buildup from reduced kidney function. Here's what's really happening. When the kidneys begin to struggle, they can't filter waste products like urea and creatinine from the bloodstream as efficiently. These waste products start to accumulate throughout the body, including in the saliva. As a result, many people develop a persistent metallic taste, a dry, coated feeling in the mouth, or even a mild burning sensation on the tongue. This condition, known as uremic fever, is often an early clue that the kidneys are becoming overwhelmed. Research published in Clinical Nephrology shows that over 30% of patients in the early stages of chronic kidney disease report changes in how their mouth tastes or feels 7 before lab results show a major decline in kidney numbers. I once heard from Roger, a 71-year-old former firefighter from Michigan, who described his mouth feeling like I licked a battery. He was convinced it was just a medication side effect, but after speaking with his doctor and requesting kidney testing, he discovered his eGFR had dropped below 50. His doctor told him he likely caught the problem just in time. So if you're experiencing an unusual taste in your mouth or a burning tongue that lingers, don't just ignore it or assume it's minor. Let me know in the comments. Have you ever noticed a strange metallic flavor in your mouth? You might not be imagining it. Tongue sign number 5. Bright red or beefy tongue. It sounds strange, but sometimes your tongue can look too healthy, too red, too smooth, almost beefy. You might even think it's a good sign of strong circulation or good hydration. But in older adults, this bold, overly red appearance can actually signal a quiet crisis happening inside your body: nutrient depletion caused by declining kidney function and a frozen. When the kidneys begin to falter, they don't just filter out waste. They also play a critical role in maintaining nutrient balance, particularly with vitamin B12, folate, and iron. These nutrients are essential for producing red blood cells and supporting the health of mucous membranes, including the tissue of the tongue. When these nutrients become deficient, often silently, the tongue responds by becoming inflamed, overly red, and sometimes smooth or shiny due to the loss of papillae. This condition is known in clinical medicine as atrophic glossitis, and it's commonly seen in older adults with early-stage kidney disease. A comprehensive review in the American Journal of Clinical Nutrition links this exact presentation to nutritional shortcomings frequently seen in patients with reduced kidney filtration. Left unaddressed, it can lead to further complications like taste changes, difficulty chewing, and chronic oral discomfort. I remember David, a 73-year-old grandfather from Colorado, who described his tongue as hot, red, and sensitive to the touch. He thought it was acid reflux, but lab work showed a B12 level far below normal, and a follow-up revealed stage 3 chronic kidney disease. His case is a powerful reminder that the body often speaks in whispers before it cries out in pain. So take a moment. If your tongue looks unusually red, feels sore, or appears too smooth, don't brush it off as just irritation. Now that we've gone through all 5 tongue signs, each with its own link to hidden kidney problems, remember, it's not just about what your tongue looks like. It's about what it's trying to tell you. A pale coating, deep cracks, swelling, burning, or an unusually red surface. These may seem like small things, but together, they can be powerful early signals that your kidneys need attention long before fatigue, swelling, or lab results confirm it. That's why monitoring these changes matters. Your tongue offers a quick, visible clue that's often overlooked, but it can help you catch health problems early and take action when it matters most. So here's my advice. Take a minute every few days to check your tongue in the mirror. Notice the color, texture, and sensation. If anything seems off or persists, don't wait. Talk to your doctor. Even a short conversation could lead to early testing, early answers, and better long-term health. And if you find this video helpful, support our work by hitting the like button. Don't forget to subscribe to Golden Aging Health and turn on the notification bell so you never miss new updates that can protect your health after 60. And before you go, be sure to check out our video on After 60. These 7 skin changes could mean your kidneys are failing. It pairs perfectly with what you learned today. Stay proactive, stay curious, and most of all, stay well.